Assalamualaikum and good day to each and everyone. I am Zaida Marzia Said and I will be presenting a case of Empyema thoracis in a 4-month-old infant. So let me begin with the patient profile. The patient is a 4-month-old male child from Barangay Bubong, Marawi City. Pertinently, the father is a tobacco user, though the mother denied alcohol or over-the-counter drug use. So the patient was admitted to APMC on May 7, 2026 with a chief complaint of fever, cough, and difficulty of breathing, initially diagnosed with pneumonia. So 3 weeks prior to admission, he developed an on and off non-productive cough. The mother consulted a health center and was given salbutamol, but the symptoms did not subside. So the family went to APMC and the mother was advised to admit the baby due to a lung problem. So the fever was associated with shortness of breath and difficulty breathing. So the patient, let's move on to the history of present and family background of the patient. So the patient has no prior hospitalization but has a minor illnesses like fever and cough. So he was born at home and has never been vaccinated. So since birth. So he lives in a household exposed to a secondhand smoke from his father and is bottle fed with formula milk called Bona. So looking at the family genogram, we can see that the father and the mother is all alive. So they, from the paternity, there is no major illnesses from the parents and from the grandparents of the patient. Action. Before the assessment, the nurse reviewed the patient chart. So usually, prepare muna yung ako bago ako pumunta sa primary patient ko. But overall naman, during, after, and before the assessment, the SO was a cooperative naman sa akin during the interview. So let's move on sa ating review of system. So in general, the patient is awake but lethargic with intermittent fussiness. So the vital signs showed tachycardia and 148 beats per minute. So the patient is at tachypnea at 60 and oxygen saturation of 91% on 2-liter oxygen. So he is underweight for age at 5.9 kg. So the flack pain scored was 5 out of 10 at rest. So nag-increase ito ng 7 out of 10 during the deep palpation sa ating patient. So So, other than that is normal naman sa ating patient. So, moving on sa ating HENT. So, wala namang essentially. So, HENT was essentially normal naman except for the presence of nasal cannula sa ating patient. So, the anterior fontanelle is also flat and soft and the eyes are reactive and the oropharynx is intact with a strong gag reflex. So, moving on sa integumentary. So, upon assessment, the integumentary is intact with good skin turgor, no jaundice or cyanosis sa ating patient. Also, the capillary refill is less than 2 seconds. So moving on sa ating cardiovascular, on cardiovascular exam naman, I have observed that the apical pulse is at the apical pulse is at 4 ICS, left mid-clavicular line at 148 beat per minute at regular. However, on auscultation, there is a soft systolic murmur grade 2 out of 6 noted at the left sternal border sa ating patient. Also, the peripheral pulses are 2 plus and equal. For the respiratory naman, so this is the key system inspection sa ating patient sa abnormality sa kanyang respiratory. He is a tachypnic at 60 CPM with shallow irregular breathing. Also, the subcostal and intercostal retraction are present. The chest expansion is asymmetrical with decreased expansion on the right side ng ating patient. And the palpation is tactile, firmitus is decreased on the right lower chest, with also tenderness. When during the percussion, there is a dullness noted on the right lower left field posteriorly. During auscultation naman, the breath sounds are diminished on the right lower lobe with fine crackles bilaterally more on the right side. So the bronchophony and egophony are positive over the right lower lobe and the oxygen saturation ng ating patient is 91% on 2-liter nasal cannula which is abnormal yon. So moving on sa ating gastrointestinal and nutrition. So the overall, the abdomen is soft with hypoactive bowel sounds. So the significant finding here is the decreased intake ng ating patient because the patient has decreased his formula intake from 4 to 5 bottles per day down to only 2 to 3 bottles per day. So moving on sa ating neurologic and musculoskeletal. Neurologically, the patient is awake but less active. The cranial nerves are grossly intact with appropriate reflex for the age ng ating patient, such as in rooting, grasping, and Babinski are present. So the motor system shows normal tone and spontaneous movement sa ating patient. Sa ating reproductive and excretory, in the reproductive exam, the scrotum is asymmetrical sa ating patient. So it is the testis or the private part ng ating patient is palpated, but the right testis is not fully descended upon inspection. So these requiring follow-up sa ating patient. For the excretory, the function is normal with adequate urine output and soft form stool. So moving on sa ating functional health patterns. So for our nursing assessment 2, so for the activity rest, so before, in summary na lang natin, before the patient is doing activities such as yung nagtatamsucking or active yung ating patient. But initially, during sa stay niya sa hospital, the patient becomes drowsy. So hindi na siya masyadong magalaw. Nakikipaglaro naman po siya, pero hindi siya ganon kagalaw, unlike before. Same with the day 1 ng ating patient. Sa ating nutritional and metabolic, before, the patient is taking a milk 5 to 8 times. 8 ounce bottle of formula milk. But initially, during nasa hospital na siya, naglesen na siya into 2 to 3 8 ounce na lang. Or 2 to 3 ounce bottle na lang yung natitik ng ating patient. For the elimination naman, the patient voids frequently changes diaper every 3 to 5 hours. Initially, nung nasa hospital na siya, naging less na lang yung pagbabawas ng ating patient. And naging liquidy yung consistency ng poop ng ating patient and in a yellow color. For the ego integrity, so according sa kanyang mother, dati kaulit si baby niyan, chubby yung baby niya. But initially, nung nasa hospital na siya, naging pumayat na daw siya. Sabi nga niya, piagtis ka niyan. So that was verbalized by the mother of the baby, of the patient. So yun, nag-change yung body weight ng ating patient. For the neurosensory, so everything is intact naman before and after. Yun nga lang, the baby is not that active na, that like before. For the oxygenation, so it was not taken nung nasa bahay pa sila. The vital signs were not taken during house stays. But on hospital stays na, yun, na-take natin siya with irregular sounds. Meron siyang tachypneic and tachycardia. Also, he is using a nasal cannula oxygenation kasi nga mababa yung oxygen level ng ating patient. So, for the pain comfort naman, the patient has no, yun nga, hindi naman niya na-verbalize yung kanyang pain. But through the facial scaling, so initially, sa facial scaling niya, you can see na the patient is on pain. Kasi nga, the facial grimace, nagkaka-facial grimace siya, and crying. So, that can be possible. And that, pwede yung mga symptoms ng in pain yung ating baby. For the hygiene and activities of daily living, nung nasa house pa sila, pinapaliguan siya always, hygiene. But initially, nung nasa hospital na siya, nag-lessen or decrease na yung pagliligo niya. Kasi, yun nga, wala na siyang energy para maligo. So for the sexuality, so the patient is a 4-month-old infant and is uncircumcised. So his civil status is child. So let's move on sa ating pathophysiology. Now, for the pathophysiology, the patient initially developed bacterial pneumonia. So this progress as inflammatory mediators were released sa body ng patient. So this causes a vasodilation and increased capillary permeability. So this leads to an exudative parapneumatic effusion. So the bacterial invasion of this fluid result in a purulent formation and pleural inflammation sa ating patient. So this is a empyema. So this is what we call the empyema thoracis. So in the fibrinopurulent stage naman, fibrin deposit caused a loculations. So making the pus more viscous and inhibiting lung expansion sa ating patient. So importantly, so this patient is being managed. So conservatively without a chest tube. So hindi naman recommended or hindi naman kailangan mag-chest tube agad. It depends on the situation or kung saan na nag-lead yung empyema thoracis ng ating patient. So pwede tayong mag-rely on other mga therapeutic medications such as yung mga antibiotic, oxygen, and close monitoring for possible future aspiration or surgery sa ating patient. So that is a summary of my pathophysiology. So for my medical management, so the actual medical management includes the diagnostic. So yun nga, na nagawa natin ng physical exam, lab test, including serum albumin and creatinine clearance sa ating patient. We gave also a medication, a broad antibiotic regimen, including the peptides, meropenem, vancomycin, and amikacin sa ating patient. And we also gave a supportive drug like budesonide or salbutamol. So, for the nursing management naman, for the actual, we administer unregulated IV fluids, monitoring outputs by weighing the diapers ng ating patient, monitoring vital signs, especially respiratory rate and oxygen saturation ng ating patient. We need to positioning the patient in semi-folder for lung expansion ng ating patient. We also need to encourage the mother to reduce the infant's exposure to secondhand smoke, lalo na yung father niya is a smoker. So also, we monitor for signs of worsening respiratory distress that would indicate a need for thoracentesis or chest tube insertion. So for my nursing care plan, I have here a three nursing care plan. So the primary nursing diagnosis, or the most important for me, is the impaired gas exchange. So this is related to inflammatory process and purulent pleural effusion secondary to empyema thoracis, as evidenced by the tachypnea ng patient, which is 60 cycle per minute, and hypoxia na 91%, crackles, retraction, and asymmetrical chest expansion ng ating patient. So for my objective, so after 8 hours of nursing intervention, the patient will demonstrate improved gas exchange as evidenced by lalaki na or magiging normal na ang kanyang RR and ang kanyang oxygen saturation. So with that, I have a interventions. We have the dependent, independent, and collaborative. So for the dependent, we need to administer a supplemental oxygen via nasal cannula. We can also administer prescribed antibiotics. We administer bronchodilators and administer corticosteroids and administer mucolytics. For the independent, we need to position infant in semi-foulers to maximize the lung expansion. We monitor the respiratory rate, depth, work of breathing, and SpO2 every 30 minutes for first 4 hours ng ating patient. We also need to perform gentle chest physiotherapy on left side ng ating patient. and suction airway if possible na magkaroon tayo ng suctioning, and also a cluster in nursing care to allow uninterrupted rest period ng ating pasyente. So for the collaborative, we need to coordinate with respiratory therapists for nebulizer effectiveness and oxygen adjustment. We need to collaborate with physician to review chest x-ray ng ating patient, work with infectious disease team, discuss the physician that need improvement, consult with dietitian. So overall, for the evaluation ng ating nursing diagnosis, so after rendering the nursing care, so the patients are decreased from 60 to 52 cycle per minute, the SpO2 was improved from 91 to 95%, and retraction decreased from moderate to mild, and crackles still present on right lower left lobe, and we need to continue the intervention sa ating patient. So for my next nursing care plan is acute pain related to pleural inflammation secondary to empyema thoracis as evidenced by the FLAC, a score of 7 out of 10, crying, facial grimace, guarding behavior, and tachycardia during chest palpation. So, ang goal lang natin dito is that mag-reduce yung pain na nararamdaman ng ating patient by showing the FLAC score, or bababa ang ating FLAC score ng, from 7 out of 10 to at least 3 out of 10 or mga 5 or lower scores. So I have here the intervention, so dependent, independent, and collaborative. For the dependent, we need to administer the acetaminophen sa ating patient. We can administer ranitidine. We can administer prescribed antibiotics, which can also reduce inflammation over time. We can obtain order for oral sucrose, and we can request physician order for topical anesthetic if future invasive procedure needed. For the independent, we need to assess pain using FLAC scale before, during, and 15 minutes after painful procedure. We need to position the patient, infant, on left side, sa unaffected side ng ating patient, and swaddle infants snugly before and during chest examination. Also, we can offer a pacifier sa ating baby. We can minimize the unnecessary deep palpation of chest. So, kailangan light lang. For the collaborative, we need to coordinate with physician to schedule chest examination, collaborate with mother to provide a bottle feed, or pwede rin yung breastfeed. Actually, sa EPMC, hindi pwede yung bottle feed. So, recommended talaga na mandatory talaga na breastfeed yung baby. So work with child health specialists for developmental comfort measures and consult with pharmacists, and we need to discuss this with physician alternative methods. So for the evaluation sa ating patient, after in the nursing care, the patient FLAC score decreased from 7 out of 10 to 2 out of 10 during the rest and 3 out of 10 during chest examination. The HR or the heart rate ng ating patient will decrease also 160 to 142, and the patient consult with 90 seconds feeding increase to 50 ml. So for my third nursing care plan is a caregiver role strain related to hospitalization of infant with serious respiratory illness, empyema thoracis, and uncertain disease trajectory as evidenced by mother's verbalized worry, sleep disruption, and frequent questioning, difficulty recalling information, and sign of physical exhaustion. So, sa objective ko, ang goal natin dito is to demonstrate, ma-reduce natin yung caregiver strain by verbalizing na okay na sila, or at least ma-report nila na their rest are enough sa kanila. So we have here the intervention, the dependent, independent, and collaborative. For the dependent, we need to ensure mother has access to rest area per liter. So we need to provide a written educational materials about the empyema and signs of respiratory distress. We can also refer mother to hospital social worker for additional support. And also, we can request spiritual support if kailangan ng mother. We need to facilitate the environmental modification, such as yung dim lights, as allowed. So, depende na yan sa environment ng ating patient. So, for the independent, we need to actively listen to mother's concern using a therapeutic communication. We can explain all procedures before performing them using teach-back method. We can encourage mother to participate in care activities. We establish quiet hour protocol in the unit and teach mother 3 signs of improvement, and also the 3 warning signs. For the collaborative, we coordinate with nursing aide to relieve mother for 2 30 minutes break per shift. We can collaborate with physician to provide a consistent daily updates on prognosis ng patient sa mother. We can work with dietary department to ensure mother receives a halal meals, and we can consult with infection control nurse for safe holding practices and discuss with case manager early discharge planning and home care methods. So for my evaluation, so after rendering the nursing care, the mother verbalized understanding of respiratory distress signs, reported at least 3.5 hours of sleep, participated in diaper change and bottle feeding, and asked 1 to 2 questions per hour, and stated a baby is drinking a little. At least na-report niya na yung baby niya is nag-feed na. So to continue a respiratory support. So that's all for my case study. So I hope may natutunan kayo in my discussion and on the case of my patient. So thank you and wassalam.